So I think we can get started. It's 2 minutes after. I'll just start off with some Indigenous acknowledgement. The group at TheraPsil just started reading the book Braiding Sweetgrass. And the first chapter is the origin story of Sky Woman creating Turtle Island. And I've just been reflecting lately on the power of that origin story and how different it is than other origin stories, and the power of perspective and narrative within our lives. And I'm really been reflecting the last couple of days about the beginning of reciprocity. I think for myself is understanding that I see my life and my experiences through a specific Western lens, because I haven't had this knowledge or these stories in my awareness, and you can only see reality based on what you know. So I'm just motivated to learn more and to gain more knowledge about Indigenous practices and Indigenous cultures. I'm in Victoria, which is the unceded traditional territories of the Lekwungen peoples, represented by the Songhees, Esquimalt, and Wasanich. And we advocate for psilocybin in the Western medical context, but what psilocybin and the knowledge of psychedelic medicines and ceremony wouldn't exist without the Indigenous knowledge keepers. My name is Natasha Fearnley. If you don't know me, I am TheraPsil's clinical intake director. I'm also a registered nurse. I've been working with TheraPsil for a couple years now, since the beginning, helping people get access to psilocybin, helping to build our processes out. And I'm really excited to head this SAP in service today. I think there's going to be a lot of important information shared as we move forward. I'll let Valorie Masuda, who's here with me today, who has a lot of experience and knowledge to share, introduce herself before I get into some background about the in-service to kind of support what we're going to talk about. But Val, could you let everybody know who you are, what you do, whatever you'd like to share with the group?
I'm Valorie Masuda. I'm a palliative care physician over on Vancouver Island. I've supported a number of patients through the Section 56 exemption process over the last year and a half, and have had the opportunity to be in their psilocybin sits with a therapist, as well as we have developed a nonprofit organization called My Community Journeys, which has two programs. One is a ketamine-assisted therapy program through Roots to Thrive, and the other one is a psilocybin-assisted group therapy program. We started in October. We've brought through 9 patients successfully through our first cohort, and are now bringing in hopefully 8 patients through our second cohort. And through the SAP process, so I'm hoping to share some learnings with my conversations with Health Canada, how we proceed through the quagmire of the bureaucracy.
Thanks, Val. Before we get into the nitty-gritty about SAP and what we've learned so far, I would love to just prompt anyone who's here to share in the chat if they've navigated SAP somehow, and let us know what your experience has been like. If you haven't navigated SAP yet, but you're considering, let us know why. Why haven't you navigated yet? What's stopping you? What are your concerns? And if you have any specific questions that you're hoping me or Val or someone else on this call might be able to answer, or we can discuss, we'll try to get to those. And Holly, who's supporting us, is going to be popping them into my document here so we can get to them at the end for a question period. Just setting the stage a little bit for this discussion. TheraPsil has supported 58 Canadians so far to successfully receive Section 56 exemptions. You probably are aware, but Section 56 exemptions allow the patient themselves to legally use and possess and transport a certain amount of psilocybin for their medical use. So it essentially decriminalizes a small amount of psilocybin so they can use it for medical purposes, mostly psychedelic assisted psychotherapy. But they need to gain that psilocybin from unregulated sources, so the black or gray market. And on January 5th of this year, Health Canada announced amendments to the Special Access Program, which you likely are all aware of, that's why you're here. But these amendments now allow prescribers to submit requests on behalf of their patients. These patients have to have a serious or life-threatening illness, and they can request a safe supply of psilocybin, synthetic or synthesized, that is manufactured or imported by a Health Canada approved licensed dealer. And what we've seen at TheraPsil with the patients we've supported is that any patients who submitted a Section 56 request after the SAP amendments, they received communication from Health Canada that their Section 56s wouldn't be considered, that they weren't being approved, and that they would have to prove that they've gained access or tried to gain access through a legal means, which is clinical trials or SAP. We've tried to advocate for these individuals who don't have a way to get access through SAP currently, through their physicians communicating to Health Canada, them communicating to Health Canada why Section 56 is still the best route. And we continue to get the same communication from Health Canada, go to clinical trials or go to SAP. Currently, TheraPsil has over 1,000 patients on our wait list. Many of those are looking for assistance when it comes to mental health specific diagnoses, some for chronic pain. And I also have over 50 individuals who are currently trying to gain access who have palliative or life-threatening diagnoses. And so just navigating how we can support them moving forward with these changes. My goals at TheraPsil when it comes to supporting patients moving forward with these changes is I really want to obviously help as many people as we can. And so I want to build out a process that empowers prescribers across Canada to support patients with psilocybin access. So I want prescribers to be able to become comfortable facilitating assessments of patient suitability for psilocybin therapy, to feel comfortable supporting patients and navigating the legal pathways, and also to understand what they need to do and how to provide medical oversight for these psilocybin treatments. And so the ways that I'm hoping to move forward to empower practitioners like yourselves and others is, first of all, building out our website so that there's really clear steps and guidelines for patients and their healthcare practitioners for all of those things, assessments, legal pathways, how to provide medical oversight and how to support us. And I'm going to have many updates on the TheraPsil's patients page, as well as the support your patients page. So if you're interested, keep an eye out. We'll also announce in our newsletters about those changes. We're also going to be creating prescriber-specific education and in-services to build out the knowledge and understanding of prescribers for the ways that we would like them to be able to support patients. And we also hope to be able to build out a system for community prescribers to request consultation with psilocybin-informed physicians, or to also request referrals to physicians who are able to take on the responsibility of supporting a patient as providing medical oversight if community prescribers don't feel comfortable doing so. So in order for me to be able to launch this process and be able to have a system for the patients we support to be connected to people who can support them and organizations that can support them, first, I really need to build out a pool of prescribers that I know can support patients and are able to take on those referrals. And so the starting point of this is just kind of building an understanding of who in Canada and who's associated with TheraPsil, who's interested in working with TheraPsil to do some further education as a prescriber or support patients who are reaching out to us. And so I've created a little Google survey that I would love anyone here to complete. It's really easy. You get to see kind of what we're thinking about for prescriber education within there, as well as let us know what you might be interested in moving forward. It's just a might. You're not signing up for anything for doing this survey. Holly's going to share the survey in the chat, and we'll also share it in the email that you'll get after this with the recording of this webinar. So yeah, please take part in that. It will really help me moving forward with our processes. So circling back to the main goal of this webinar, we want to empower prescribers. We want to support as many patients as we can. And we realize that right now, there's still many unanswered questions about the current legal pathways, including SAP access. And so I'm going to hand it over to Dr. Valorie Masuda for her to now share her experiences with SAP, what she's learned so far, and anything else that she thinks could be informative for us as a group. Thanks, Val.
Right, unmute. So I just wanted to first say that we've had a lot of discussions with Health Canada, and they're two separate pieces of Health Canada departments. One is the Exemptions Office and one is the Special Access Program. And it was interesting when we first started having conversation with the Special Access Program, they admitted that we actually don't talk to the exemptions department very much. And so we managed to actually get a meeting. It was myself, a representative from TheraPsil, a representative from MAPS, and a representative from the Canadian Psychedelic Association. We met with Health Canada, with the Exemptions Office and the SAP office in the same room, which was super informative. So what I'd like to do is start with what is Health Canada's reasoning behind changing from the exemption process to the SAP? So basically, exemption is basically decriminalizing psilocybin for one person so that they can access, store, ingest a substance which is controlled. And I think Health Canada was okay with providing a few Section 56 exemptions for this, but then when they get the swamp, as the Canadian public says, hey, this works for so many things. People do their research, they see what's out there in social media and the regular media, and they say, we want access. So Health Canada gets now hundreds and hundreds of requests for Section 56 exemptions. Now, Health Canada's mandate is to protect the Canadian public. They look at regulating food and drugs, and this is being a drug, but an odd drug because it's being consumed as a botanical. It's not a food, but it's a botanical. And they said, we cannot, as a government service, health service, be condoning the use of Canadians accessing, product we have no way of monitoring or scheduling or anything. Like, we have no control over mushrooms, and we don't want to be seen as supporting this process, even if it's on a compassionate basis. So how can we do this, give Canadians access, where evidently the Canadian public is saying we want access, but do it in a safe way where we know that Canadians will be accessing safe and secured product. So they refer to the SAP program, the Special Access Program. So they basically say no to exemptions. We do not want to be involved anymore in decriminalizing this substance for people to be consuming for whatever reason. So that door is essentially shut. So now we go to the Special Access Program, and they say, what the program is designed to do is, if, for example, somebody has a very rare cancer, or they've tried all known treatments available in Canada, and the oncologist notices that there is a study in the UK using a product that is approved in the UK or the States that is not available in Canada, they actually can apply for special access to this particular product to administer to their patient. And what they have to do is their due diligence. They read all the literature associated with it. They ask the manufacturer for their human data so that those manufacturers actually produce a product that has been involved in stage 1 clinical trials and is on the way to finishing stage 2 clinical trials. So Health Canada is pretty sure that these substances are safe for human consumption. So once a physician establishes a producer that's willing actually to provide the drug, and the SAP program, he was basically saying, we have a drug in the States we know is going to help this little kid with this very rare condition, but the manufacturer will not produce it in a dosage form that is suitable for this pediatric patient. So there's nothing to approve. So the oncologist, say in this case, the physician has established a producer, has reviewed the stage 1 and stage 2 phase 1, phase 2 clinical trials, has received the human safety data from that producer, and is pretty confident that this is a safe medication for his patients or his or her patients, can then apply to the special access program and say, this is my patient, these are the treatments tried and failed, this is the treatment I want to try, this is the human safety data for it, and can I try this? And I'm willing to procure the drug, I'm willing to administer the drug and take responsibility for the administration of this drug. And I will report back to Health Canada as to the effectiveness of this drug and any adverse effects. So this is what the special access program is about. So, you know, they say this was never meant for psilocybin, but Health Canada has actually been going back to the producers and trying to figure out how they're going to navigate this with psilocybin. Now, the exemptions office went out and asked all the producers of psilocybin, the people who have a section 56.1 exemption, to allow them to produce psilocybin either by growing mushrooms or producing synthetic. And they approached them and said, hey, does everybody here want to be on a list of, you know, potential suppliers? And everybody said, oh yeah, we want to be on that list. So they have this huge list of potential suppliers, but only two of the companies on that list actually have product that has undergone phase 1 clinical trial. And only 2 of those names on that list are able to provide to the special access program. So it took the Health Canada special access program actually went to all these people and called them and established whether or not they were able to supply. We had first gone to USONA, which is the supplier in the States that is supplying just about all the clinical trials in the States. And they said, no, our mandate is to actually supply clinical trials. We have been approached by many groups about supplying programs. It's outside of our mandate. We will revisit this because Canadian Special Access Program went to them directly and asked about this. They said it would take many months for us to sort that out. So the Special Access Program then came back to me and said, there are 2 companies you can approach that we have product that we would consider safe for human consumption. So having said that, I have to then contact the companies and say, I want this amount of psilocybin. Are you able to provide that to me? So the answer is, yeah, but are you able to treat the patients with our product? Because the producers don't want to just, you know, give away their product willy-nilly to, especially physicians who don't have any experience in treating people in the psychedelic space. They don't need the bad press if something goes wrong, and they don't need that bad press reflected on their product. So they're very cautious. So for me, we have a nonprofit society. It cost us $22,000 to get insurance to be able to administer psilocybin in our space. Just the liability insurance alone, because we're using a controlled substance, was extremely expensive. And so we managed to get donations to cover that cost. But, you know, we had to show our liability insurance to the producers to show them that, yes, there was a team of experienced therapists and physicians and nurses that would be administering the medication within a program that they felt very confident about and safe about. So once we received the okay, then I had to get their safety data, which is, you know, I had to sign confidentiality agreements that I would not share one company's data with another one or anybody outside of myself and our team. And I had to review that. And then I can actually say to Health Canada, I have reviewed the human safety data. This company is willing to supply me with this much psilocybin, and we're ready to go on this date. So that's what I've had to do to negotiate the SAP process. So, you know, we look at how do we go, like if I had a single patient, how would I support that patient? I'd have to fill out the form. I'd have to find a producer, which, you know, and it would be really developing a relationship with one of those producers, because you'd only have to do this once, right? And if other producers come on board, they may come to you and say, hey, we'll offer you product too, you know, but I've had a lot of producers come to me and say, hey, we'll offer product too. And I'm like, but Health Canada is not, SAP program's never going to approve your product. You haven't tested it on humans yet. So, so there's a lot of navigating that. So once you've developed a relationship with the producer, they're willing to give you product in the dosage form and the amount that you need, then you have to, use that in your application. You have the producer, that they're willing to provide for that specific amount. Having said that, even the producers that are Health Canada potentially approved because they have had clinical trial data, they don't always have product available on hand. So that's another consideration. So does anybody have questions at this point?
I would like to jump in here, Val, and just ask if you could touch base on the status of your current SAP requests. Have they been approved, or are you still waiting for verification from producers?
We've gone through all the steps. I've resubmitted our application with the verification from the producers and the commitment to provide the exact milligram of product that we need in the form that we could use. Because we're treating 8 patients simultaneously, we're able to access enough product to be able to treat them simultaneously on a certain date. So I am still waiting at this point, but we've gone through all the process of the rest of the process of application. So we do have a producer who is willing to supply us that amount. I do have a sample SAP form that we could go through just to show you, I think most importantly, how you would represent a patient, and also we have a list of the references that you would need to attach to your SAP to demonstrate that you have in fact done your research. And I would encourage you all to read the references and pull the reference material. Any other questions?
I see Ryan's has a...
Hi there. Yeah, my name is Ryan Mader. I'm a physician, family physician in Victoria. Valia, thanks so much for the talk. And I was just wondering, can you share with us who the providers are, the industry providers are?
Good question. The one is Cygen. Cygen has a synthetic product, and the other is Filament. And Filament actually has a natural extract, and they are currently supplying phase 2 clinical trials in Canada. And Health Canada said, hey, if they're supplying clinical trials, that's good enough for us if they're phase 2 clinical trials. So they have sent me their safety data, but I am not allowed to share that. But they do have an extract from a natural product, Filament.
Okay, thanks. And does one company seem to be more accessible than the other through this process?
I think they're both pretty keen. They're both pretty keen to demonstrate that their product is safe, and they're keen to demonstrate that they can provide the product through the SAP program because it's good for them. But that saying, you just have to develop a relationship with these people. I know that Filament has, they're able, I think, to supply in small amounts at this point, but Cygen cannot at this point produce like small amounts, like 25 milligram capsules. They have very limited supply of that. But what Filament does is that they extract the psilocybin from the mushroom, and then they freeze dry the extract, and then they encapsulate it. And so they have product, they say they have product on hand in 25 milligram capsules. So 25 milligrams of psilocybin is what generally has been the dose that was studied. And when you look at the studies, they've looked to say, is there a dose response relationship? And there doesn't seem to be a very clear dose response relationship. There's kind of low dose and high dose. And in the studies, they generally just gave everybody 25 milligrams. And then went with that. They didn't, they had one, USONA was providing 25 milligram capsules. Everybody got a capsule. There was no milligram per kilogram dosing.
Great, thanks for explaining.
Okay, I'm going to share my screen just to share the SAP.
So can I ask a question as well, please?
Yeah.
So the list provided in Health Canada of producers that they have approved, they've given a license to cultivate and grow. You're saying that even though Health Canada has approved them, they may not allow you to access their product through the SAP?
So you still have to provide, so if Health Canada says yes to these two producers, you can access the product, and they said they will provide for you. You still have to give enough evidence that your patient requires the use of psilocybin, and under what conditions you're going to be giving it to them. Does that make sense? If they could still deny you, they could say, it doesn't look like you've tried everything. So this is where in the application, I think there's good evidence to show that people, particularly with end of life existential distress, there are no current effective treatments. So they don't have to be on several antidepressants and anxiolytics in order to apply, but I think it's important to incorporate that in your SAP request. And so I'll show you the references for that. And maybe Natasha, if I send you can you see the right thing? Does it say SAP? Am I sharing the right?
Yes.
Okay.
Yeah, we can see it.
What's the right screen? I can't see the screen.
So Val, are you saying that through the SAP, you cannot access psilocybin as a raw product, but they want you to access it as, pre-made capsules and either or synthetic?
So basically, they will only approve a drug. Now, extracts, there's sort of a gray area for extracts. So if the extract says they can prove a milligram per mil amount, then they would consider that because, for example, Sativex is an extract. So, there are other medications that are extract based, but it has to be able to have a DIN number associated with it at some point. So they won't, at this point, say, yeah, you can have just like raw psilocybin. It's hard, like having a psilocybin powder, if you're trying to put 25 milligrams in a capsule, which they have done in certain studies, like Cygen has provided to the UK, and they've just sent, packages of raw psilocybin, and somebody there has compounded it by hand. But that's not something that SAP is really into, right? They want you to be dispensed exactly what you need from the producer, so you don't have any floating around. So for us, if we're asking for 8 patients, we're asking for a vial of 200 milligrams, which they can provide, and then we're going to reconstitute it. And because we're treating everybody immediately, we'll reconstitute it with 200 mils of D5 or sterile water. We'll dissolve it, and then everybody gets their 25 milligrams from that. So for us, it would be easier. But to do one-off with 25 milligrams, it'd be too hard to get 25 milligrams of powder. Well, they may be able to put 25 milligrams of powder in a vial, and then you can reconstitute it. But they're not kind of at that point yet. So I can go just through the special access program form. So, this is all easy peasy stuff. The key is sending the drug. So currently we do not have pharmacies that can accept this medication. And particularly since the physician is the one administering the medication, it's important to either for it to go to the practitioner's office. Hospitals will not accept psilocybin at this point. Or health authorities, they don't want to be involved with the liability of that. If you are accepting the psilocybin, you have to demonstrate to Health Canada that you have a facility which is locked. So if you have an office and you have a locked door and a safe, and the safe is integrated, like the safe is screwed into a wall or a floor or something, then you can store that product and safely. So then we'll go into the manufacturer. You have to put the manufacturer in. and just PO order, I think it's kind of dumb. It's just your invoice or a number. And then for us, it's always oral ingestion. And for us, it can be either a capsule or it can be a powder that's reconstituted. If you, in fact, for us, for example, we have 8 patients. If one died or dropped off the program and we are able to bring somebody in, another person in to replace that person, then we could actually request that supply for the one patient is transferred to another patient. Now, the patient information is very interesting because yes, you can put multiple patients on one form. The patients are actually de-identified and they're only given by first and last initial and the date of birth. So in fact, SAP isn't really interested in the whole, the patient as a person, but just wants to be sure that they are approving an appropriate use for this medication. We have 8 people, so we're, the amount of drug that we're requesting is like 200 milligrams. But in this case, I just put like 2 patients here and how much you're asking for. And then they want to know when you're administering or dispensing the drug to the patient. And then they want the clinical rationale about emergency for which the new drug is required. And this is where I've just put some samples of how we've approached this. So you have your patient, who they are, what they're suffering from, why they need, what the indication is for the psilocybin. And this has been very important, is that as described in reference, this form of distress is resistant to conventional treatments. And there's a reference for this. And this is a reference to a Cochrane study, Mitchell 2011, which actually indicates they did a big meta-analysis of antidepressant treatment in cancer patients suffering from depression and anxiety, and showed that there really wasn't any significant benefit to any of using this big meta-analysis. So I think it's very important to include that particular reference. So for me, I had a number of patients I had like 3 patients in this cohort were young women, they have young families and they don't want to take a sedative. I have another patient who it's against your core values to take antidepressant or a sedative. And, I think bringing those issues about who your patient is and why they don't necessarily want to try an antidepressant, because not only are they ineffective, but they don't want to actually use those medications, doesn't mean you have to trial your patient through many, many different medications. And certainly for our end-of-life patients, we don't have time to trial them through multiple antidepressants. So, so this was just sort of an example of how I've presented the patients. And again, not having a list. Some patients do have a list of antidepressants and things they've tried. With the exemptions process, I've had patients denied who have tried really everything. And yet some bureaucrat stamped, no, not approved. And I've had patients die with their Section 56s denied with extreme existential distress. So I think that this, if we manage to find a formula that works with the SAP program, the government's like, okay, we're providing access to Canadians and we're doing it safely, then this will be maybe not a bad way to go. So at the end of all this, you sign your attestation document, yeah, everything's correct. And then I have a list of references about the use of psilocybin, the effectiveness, and under the conditions at which you would want to administer the psilocybin. So this isn't a physician walking into a patient's home, giving them a drug and walking away. What I see is physician therapist teams who are very skilled in doing the pre-work, and in all the literature we have, you have your 3 90-minute sessions with the patient for preparation and intention setting. You have your 1 psilocybin treatment, usually with a dyad, either could be a physician and patient, therapist, or 2 therapists, where the physician comes in, administers the medication, sits for a bit, leaves, and is on call. but also is circling back to look at the effectiveness while the therapists then do the sit, as well as the 3 treatment integration visits after that. So, so we're happy to share our lists of references with you, so you can have something to read too. But I think it also looks towards, and some of the references are not particularly relevant to the specific SAP application, but it just does demonstrate some knowledge within the use of the psychedelic space for these patients.
Val, I would love to jump into some questions now, just having a look at the time. And before we do that, I'll just throw out there that all of you probably know that TheraPsil has a training curriculum, and we have a lot of therapy teams and practitioners going through who can potentially support physicians within the context of these SAP requests. And so if you're a physician or a practitioner who's looking to support SAP requests, TheraPsil is working on establishing a system to be able to connect these treating practitioners who are trained with the prescribers, so that we can build these teams out. And so reach out to us if you're looking to make those connections. Something that's coming up for me, Val, is just the thought around when I connected with Health Canada at one point, I was communicated that Section 56 exemptions may still be considered if that it can be proved that clinical trials and SAP isn't a reasonable route. And I'm just wanting to throw it at you, the thought around, do you think that as we navigate SAP moving forward, and as we learn more about who gets access and how it is accessible, we'll have more rationale to be able to share to the Section 56 office about how these Section 56s still should be granted, and we may move back to that process at some point?
I don't think we'll ever move back to it, honestly, because Health Canada does, again, they do not want to be in a position where they are seen to be condoning the use of an unregulated and unsafe product. End of story. And I think that's why they shut it down and provided another portal for access. So quite honestly, every time I discuss this with Health Canada, it's the same message. Find a clinical trial, do SAP. We don't want to talk about it anymore. You know,
it sounds like they can't say 100% the Section 56 is a no because of the whole compassionate perspective, but they're just going to keep directing us away. And I'm thinking that maybe then what's going to happen is if we prove that SAP isn't accessible, and if we see the ways in which it isn't getting people access, maybe then we're moving forward towards regulations.
I don't see it happening, because quite honestly, if you look at which is better, having these producers do like cannabis, like sit on the, everybody and anybody can access it, any doctor can prescribe it, people can just, people are microdosing, but this isn't microdosing, this is taking a psychedelic dosing. And you know how vulnerable people are, emotionally vulnerable, psychologically vulnerable, physically vulnerable in that space. They do not want to be putting Canadians at risk. And it is what I think they want. And they understand that these medications are very powerful, that they can be used effectively for depression, anxiety, probably substance use disorder. And they want to make sure that they do this right, so that they want to make sure we're doing this correctly. So we're not going to shut it down like in the 1970s, where it just like, poof, no, this is not going to happen. So if we do it right, if this is where Health Canada is thinking, if we do this right, we can possibly have programs developing with using these psychedelic medications in a really helpful way. But what they've done is they put the cart in front of the horse, right? They are saying, yeah, you can do SAPs, but there's no physicians to prescribe it. There's no multidisciplinary teams that can support, groups of people to have access to treat actual treatment, right? So this is where I think there's going to be a bit of a stop. Unfortunately, even though I'm very, I've been working very hard to get my group through. As soon as my group's through, they're going to say, hey, other people are doing it. So figure a way out. So this is where I see TheraPsil as being able to support patients by getting together these therapy teams across the country, where you have a prescriber linked with some therapists, where you can prove to Health Canada, we are going to do this right, even outside of a clinical trial. Because let's face it, there will be clinical trials, but it's not like Big Pharma, who has billions of dollars that can pour into a clinical trial. These are grassroots organizations who have no money. And so we are having to rely on, you know, clinical trials out of the universities, and CIHR has just announced that they're going to dedicate $3.5 million towards psychedelic therapy for, I think it was substance use disorder specifically. But, you know, these are going to be years and years coming down the pipe. We're not looking at what are we going to do now. So now what we have to do is train people, get physicians up and running, supported by therapists, so we can start delivering this medication out in the community safely and effectively.
Amen. I'm just going to jump to another question here that maybe I can answer. It says, I'm keen to do the TheraPsil training and wonder if it's worth waiting for the prescriber training or applying to the current training that's available. And so just to speak to that, the current training that's available is an intensive, usually week-long, in-person training that's supposed to prepare you to be able to provide the psilocybin-assisted therapy in a cohort or in a dyad. And so you're trained to be able to hold space, to understand how to be there for someone, and do experiential if we gain access to be able to do that. And so the prescriber training that we're creating is almost like supplemental education to anyone who's either done that training, so that they understand specifically things focused for prescribers, like inclusion and exclusion and patient safety and medication discontinuation. And so if you're a prescriber who's providing medical oversight, you don't necessarily need to be there on the treatment day or be the core treatment team. You may have therapists that are doing that have completed TheraPsil's training, and you may be providing medical oversight, which you'd get all that information from our subsequent educations that we're going to be launching. So if you want to gain a week-long education about how to actually do the psilocybin-assisted therapy and feel confident to do that, yeah, sign up for our training, get into that. That's amazing. We love to have prescribers who can do that. But if you don't have the time, or it's too much of a commitment and you still want to support patients, these extra modules will supplement it and will be another building block to be able to help physicians do what they need to do. So someone's asking, I would love to know more about what SAP might look like for patients who are in the hospital.
Oh, well, it would be a no-go, because the hospitals will not allow you to go in with a controlled substance and treat the patient. It would be a no-go. We found when we were, so our program was running through VIU and our health authority, but as soon as the health authority, when we tried to bring in a psilocybin arm, because we were using ketamine for psychedelic assisted treatment in anxiety, depression, as soon as we said end of life patients, VIU dumped us. And as soon as we said psilocybin, our health authority dumped us. You know, it's just like, oh no, we're not doing that. Just a comment on experiential training. I know that this is my personal view, is that everybody who does psychedelic medicine should have experiential training in the psychedelic space. And currently there's no legal way to access this. You can access ketamine assisted psychedelic therapy if your primary care physician writes a little referral saying, hey man, this guy is really suffering from whatever, and they should be referred to a program, which is an underhanded way of accessing it. But the only way that Health Canada is going to let healthcare providers, and they've said this many, many times, access experiential training is through a clinical trial. And I think we could, as a community, develop in conjunction with a university or several universities, a clinical trial looking at administration of psychedelics to healthy volunteers to see whether or not that are training in provision of psychedelic therapy. There are a lot of producers out there, as you saw on the big list that Health Canada has released. and they don't have any human safety data. And they will not get any human safety data unless they do a phase 1 clinical trial. So I see big opportunity in connecting with these companies and saying, look, we have healthy volunteers here who want experiential training. Why don't we all get together and do a phase 1 clinical trial with these products, right? So, you know, incorporating universities, producers, because we don't have big pharma on our side, right? I think this is the only way we're going to get experiential learning into the system, is to do it through a clinical trial. Because Health Canada is just not going to say, yeah, you guys can go and have a good trip. And whoever wants to say, hey, I want to have some training, can have a good trip too. They're just, you know, that's, of course, I'm being cynical about it, but that's where they're coming from, right? Like there's no medical indication for taking a medicine, you shouldn't take it. And so training is not a medical reason.
I'm sorry.
Another question.
Really quick...
Oh,
sorry. I just had a quick question, because you mentioned that you were transitioning, or you were adding onto a ketamine program, and I know that's not the point of the talk, but I'm registered for a ketamine training coming up, and I'm just wondering, like just a 10-second overview of why you would move to psilocybin above ketamine, or how ketamine's been effective for your patients.
Yeah, so you know, I've been through ketamine training program as well, and this is where I'm springboarding off into the psilocybin realm. Ketamine, you know, the time at which the brain actually has the potential to be plastic, right? You're talking about a 90-minute session with IM ketamine, for example, and it doesn't appear that the effect is very durable. You know, people are often having to be redosed, and you know, in some clinics people are being dosed every week, kind of thing. With psilocybin, when we look at the data from randomized clinical trials, one dose has a 14-month effect, and it's probably because people go really deep. So, you know, I've had experiential training in both. Ketamine is like this, and psilocybin's like this, right? You go super deep and for super long. So, you know, you're looking at a 4 to 6 hour period of being in the medicine versus ketamine, which is sort of in and out. So, you know, the data, there are ketamine trials with people with existential distress, and ketamine's legal and it's easy to access. So there is a potential for developing these models in the ketamine space, but psilocybin just seems to be just that much more effective as far as one treatment and long durability of response.
Thank you very much.
Can I ask a question about SAP again specifically? Mm-hmm. So you had mentioned going to Cygen and Filament and getting their safety data. Mm-hmm. Was that a requirement in order to apply for SAP, and did you include that data along with the application, or was it required?
Yes, I had to review it. Health Canada had specifically asked if I had reviewed the human safety data with this, and says it's your responsibility as a clinician to ensure that this is safe. And because it hasn't been through phase 3 clinical trials, once something's through phase 3 clinical trials, you can prescribe at, you know, with gay abandon, but because these have only kind of gone through the phase 1 clinical trials and have not completed even phase 2 clinical trials, then they're like, you need to do your due diligence, right? And you have to show us you've done that. So yes, they have Cygen and Filament safety data already, but they want to make sure that you've also reviewed that. And so their liability is transferred, the liability transfers to you, and the responsibility transfers to you as a clinician.
This is a great lead up, Val, to a couple more questions here. So where in the process does the physician like call up Cygen, and Filament and say like, can I access?
Yeah, when you have a patient.
Mm-hmm.
Yeah, when you have a patient and you have a plan about how you're going to treat the patient, you have a plan about okay, I can acquire it, I have a place to store it, and I have a plan on how to administer it. Even in all the clinical trials, right? Even though there was a therapist dyad that was sitting with the patient, a physician was required to take the psilocybin out of the safe, bring it to the patient, and witness ingestion before they left the room. So even in the clinical trials.
That was my question. I meant more like in the context of when you're filling out the SAP. Well, I'm not a physician, so let's say when a physician is filling out the SAP form, do they fill out the SAP form first and basically name Cygen or the other company? Do they put that in the manufacturer's thing, submit the form, then call them up? Do they call them up first before they're even filling out the form? Filament, sorry. Where in that process are they actually calling up Cygen or Filament and saying, hey, I'm filling out a SAP, I need to get some psilocybin from you guys?
Before they actually fill the SAP, they should contact the producer and say, one, do you have product on hand that you could provide for my patient? I have one patient, do you have 25 milligrams of psilocybin available? That's the first thing, because you may put in the whole SAP application with Cygen, and then they say, oh, we didn't know you were doing this. We don't have product for you. And then you go, oh, I have to reapply with somebody else. So at this day of age, early days, yes, you have to contact the company directly and get a guarantee that they would supply.
Perfect.
Val, you are going to have to provide that company information about your treatment plan, correct? So that they feel comfortable. So you want to have that created before you reach out.
Yeah, you want to say, I'm not just Joe Blow physician, that I've gone through some training, that, I've done this before, that I have support with whoever therapists, and this is what my plan for administration. Because again, they're kind of like for me, I had to show them my insurance policies, right? Like it's not that easy, and they're kind of navigating this as well. So we're the first people outside of a clinical trial that they are going to be providing for. So, I said, really, it's going to be really important for you guys to get up and running as to what is your policy about, providing one-offs to physicians, like 125 milligram capsule to a physician who wants to treat one patient. And so they're still navigating that space too.
And someone mentioned, aren't the manufacturers released from any liability with the outcome of the SAP, as it's solely the responsibility of the prescriber?
Yes, but maybe not. And one thing they don't want is bad press. Like they may be free from liability in the courts, but they're not free from the liability of bad press if somebody goes public. So that's what they're really fearful of, because it's a very secret. They're very secretive about their product, and it's very, very highly competitive right now. So you look at pharmaceutical companies, they have gone through phase 3 clinical trials and they produce a product, and yet there may be a class action lawsuit about some side effect or adverse effect that comes out years later. So they're not completely free from liability. So I think this is a new space. So they're really tiptoeing that carefully.
We have a
oh, sorry.
No, it's okay. You can go.
Like when you spoke to Health Canada, Val, did they explain why they would approve so many people to be able to cultivate or grow psilocybin, for instance? And then, like, who are these people? Like, what do they approve them for now that they can't actually sell the product anywhere legally?
They approve them for research. They approve them for growing and supplying clinical trials. If you look at what they've actually, Section 56.1 is for, it's not about providing to the public, it's about providing for clinical trials. And that's kind of where it goes. And they will also now say you can apply, you can now provide through the SAP. So the one part of Health Canada is saying you have a Section 56.1, you can provide clinical trials in SAP. But SAP is saying, whoa, we're not going to approve, companies that have not finished the phase 1 and phase 2 clinical trials, right? So that's the two don't talk to each other thing.
Ryan, I see you have your hand up as well.
Hi, thanks. Yeah, you'd mentioned, Val, you'd mentioned $22,000 in insurance, liability insurance. That's obviously cost prohibitive for the vast majority of providers out there. And I'm just wondering what kind of legal guidance you received in regards to that, and you know, within the realm of medicine, what the CMPA has directed you, if anything.
So that's a good question. We were kind of looking around for insurance because we were kind of kicked out of VIU, and we went to we kind of explored, what do we need for insurance, like for general liability insurance? And everybody out there was like, you're doing a controlled substance that's actually legal through Section 56 exemptions. We're not going to get involved. So we ended up going through Lloyd's of London, who actually insures the clinical trials. And this was the first time they actually insured a program. We had to do, they were originally going to charge us $35,000, and we managed to talk them down to 22. And we talked to CMPA, and CMPA and the college are pretty hairy-fairy about it. They go, CMPA says, well, we'll protect you for anything that's within your scope of practice, but you should check with the college. They're the ones that determine whether you're practicing within your scope of practice. And then when I go to the college, they go, well, it's kind of like alternative medicine, so you just have to conform to the alternative medicine guidelines. I said, well, this is now legal, right? Like, and they're saying, well, you know, we're not going to bring out any policy till it's mainstream. So we, in addition to the CMPA liability insurance, which is like $2 million, we have a top up to $5 million through our general our new liability coverage, which also covers all the therapists and the nurses and people who are not medical professionals that are working within the team, as well as the venue. So it would be up to your individual office insurance. Yeah, it would be, it's about the venue, right? Like if you're giving the psilocybin in a patient's home, the patient holds the liability insurance, I think, because it's a patient's home. But if you bring the patient into your clinic, it's a totally different situation. And you'd have to ask the insurance agent who holds the insurance policy with your clinic to determine whether or not that would be okay with psilocybin. Ketamine is no problem, at least in BC, because the college says you can give ketamine like anywhere.
I'm sorry, Val, have you actually done the home, like administering in, or do you know people who have done that?
Yes, I have done home for a number of patients of mine with a Section 56 exemption who were just, it was before we did the group therapy, and for people who are too unwell to actually participate in the group therapy. So I've had about 5 patients where I've done them at home.
And what insurance are they using? Like what type of insurance are they actually getting?
So I'm just using my professional liability insurance, and the patient is in their own home. So they're completely like, I'm not paying for that venue, right? So I don't have to pay.
So they don't need to get insurance realistically if they don't want to.
Not the patients, yeah.
That makes sense.
I would love to just note the time and just respect that if anybody needs to leave. We're almost through. This is an amazing discussion. And I have a couple more questions here, Val, about the dosages of the substance that you're asking for, if you have time to dive into these before we wrap up. Okay.
So really, synthetics come in 25 milligram capsules. That's been what the studies have been, been using, is just one 25 milligram capsule. So, so most of the producers, like even the botanicals, like Numinous, would actually dry mushrooms and package them where they know that package of mushrooms contains 25 milligrams of psilocybin. Then they do have different dosage forms, like 10 milligrams, 20 milligrams, or 25 milligrams, 5 milligrams, sorry. But the, like I said, the Zygen is producing it in powder though, and then they will, and they can't encapsulate it at this point that I know of. And then Filament is freeze drying their extract and putting it into capsules, saying that there's 25 milligrams in this capsule. So we're not doing milligram per kilogram. We're just, now for us, we've been allowed, for our last cohort of patients, we've allowed them to make a choice, because we used actually whole mushrooms that were verified by a mycologist, and we let them pick between 2.5 and 5 grams of dried mushroom, which would be the equivalent of like 12.5 to 25 milligrams. But I mean, we didn't test the psilocybin amount in that, obviously, in the dried mushrooms. We just had them donated through a just not a producer, but just a individual who was trusted by the team, who grew them themselves.
Do you know the cost of that, Val? Are they charging patients at this point?
No, Cygen is providing for us free of charge, and Filament was prepared to provide for us free of charge, and the first cohort had a donation. So yeah, people, the companies, they, you know, what's in it for them is if they can provide certain patients free of charge in the early days, they're asking, hey, can you do some vitals before? Can you report back to us about the effectiveness or adverse effects? Like, this is post-marketing surveillance, right? And they're all about doing that. So, you know, if you have a really good relationship with them, I think in the early days, we'll be able to access free of charge. On the street, you're looking at about, you know, 40 or 50, like $1 a gram, I would think, for a dried mushroom. But, you know, as times change, I think that might go up as we start seeing demand go up.
Well, it feels like we've answered a lot of the questions that were asked in the chat. Before we wrap up, I'll just do one other ask of the group. If there's anyone who has any dying questions they really want to ask before we wrap up. Oh, amazing. That was such a good discussion, Val. Thank you so much for sharing your experience and for like paving the way, Val, for physicians in Canada, because if it wasn't for you working with us at TheraPsil, I don't even know where we would be and what we would be doing. And since the beginning, you've been here advocating for this publicly and advocating for the patients that you support. And I'm seeing these patients come to me after they've done the My Community journeys and expressing like how healing and how safe the container is that you're providing over there and the work that you're doing. So I just want to send you so much love and appreciation for everything that you do, Val. I know you've been really busy. Yeah, and everyone else here.
It's not paving the way, it's shoveling the way. Right?
Yeah,
There's no paving going on here.
Thank you, everyone, for being here. Thank you for supporting psilocybin access. Thank you for being interested in it. Thank you for advocating. Thank you for speaking about it. Thank you for supporting your patients. Thank you for learning with us. And everyone will receive an email recording of this webinar, which will also have that prescriber survey that I would really appreciate if you could fill out. It'll take you 2 seconds, but it'll be really informative for us. And keep an eye on our newsletter and our websites for changes in our clinical protocol that'll guide prescribers to navigate these new processes. And final sign off from TheraPsil is we're going to just keep advocating for psilocybin to be accessible, including regulations. Like, we believe that this should be available with prescriber being able to provide this for any patient in medical need and not just those who have someone who can navigate SAP and meet these criteria. So keep following us to learn more and keep supporting us. And if you want to reach out to anyone on the team, our emails are all our first name at therapsil.ca. So if you want to contact any of us, thank you so much, everyone. And I hope you all have a wonderful rest of your day.